Welcome to our continuing series on homeopathy. As always, with our beloved friend, Dr. Pachegaonkar. Namaste. Today, a very interesting discussion on the limitations of homeopathy. Sir.
See, basically, homeopathy has wonderful scope in treatment of so many medical disorders, but it has its own limitations also, especially where what we call true surgical disorders, where there is a gross organic disorder, for example, congenital anomaly, like if it is imperforated anus in infant, there you have to intervene with surgery. Our homeopathic medicines will not be able to achieve the perforation. Similarly, some congenital heart anomalies. There are some septal defects and all which get all right without any surgical intervention, but most of the organic disorders, they do require surgical intervention along with homeopathic treatment.
So, heart attack, and
Heart,
then arteries totally blocked.
yes, if it is like beyond say 70%, 80%, that too major branch of artery in coronary blocks, you do require some urgent intervention. But much depends upon how the blocks are formed. If the blocks are formed very slowly, gradually they get built up, then body also has a potential to develop collateral circulation in the heart. And we have seen cases where the major branch of coronary artery is 100% blocked, but the collaterals are well developed and the person doesn't get heart attack. So, but there are few organic disorders, like for example, in rheumatic fever, if the wall of the heart is damaged so much that mitral incompetence is there, and because of that there is heart enlargement and congestive cardiac failure, there you need either replacement or a repair as an urgent measure. But if it is marginal, we have treated some cases. We have treated few cases of mitral wall involvement in rheumatic fever conservatively, and for whole life the lady did not require any surgical intervention. But there are cases where if the gross pathology has already developed, then we may not be able to reverse that phenomena efficiently. Basically what happens, the homeopathic treatment depends upon the own potential or vitality of the person. If the vitality is too low, then the person, even if there is a strong stimulation with homeopathic remedies, will not be able to cope with the situation, and that reversal may not happen. This is what happens in terminal illnesses. For example, malignancy. If the malignancy is just beginning and body has responded to that malignancy efficiently so that the progress of the malignancy is not allowed to get accelerated, there the prognosis is good. But there are cases where the whole vitality is worn out and person doesn't have that strength, then homeopathic medicines will not be able to exhibit good action.
No, if we're speaking about something like appendicitis with peritonitis or something.
See, in appendicitis also, if it is a plain appendicitis, it can be treated conservatively. Even nowadays, surgeons also are treating appendicitis conservatively. But if there is a chance that it may get perforated because of the uncontrolled advanced inflammation, if it gets perforated, there also we have seen some cases where the greater momentum plays its role and it closes the perforation by itself. The healthy human being has that potential. We have seen some cases where It is a perforated appendix, whereas the greater omentum has sealed it for a while. So such cases also are there, but really if it is already perforated and if peritonitis is there, then you need urgent surgery. Otherwise person goes in paralytic ileus, what we call, and it can be fatal. Not only, there are some simple incidences where suppose a dehydration. The person has developed sudden purging. There our homeopathic pills will not be able to rehydrate the person urgently. So you need to give what we call IV fluids, intravenous fluids as a supplement to overcome the sequelae of diarrhea or vomiting. There also we do add what we call auxiliary measures along with homeopathic treatment.
What other
There
things?
are some conditions where the pathology is, if it is too advanced, we suggest even palliative therapy. For example, like we have some rheumatoid arthritis cases where the pathology is so advanced, the contractures are there, the pain is such that the person cannot sleep properly. So many times we do allow what we call pain relieving allopathic medicines along with homeopathic medicines. There we advise them to take those medicines as a temporary measure at night, so that the person is not exposed to exertion or anything. So daytime we suggest, doesn't matter, you bear the pain. But night, if person takes some sort of pain relievers, of course non-steroidal pain relievers, then we give homeopathic medicines. There is one more limitation for homeopathic medicines, that all naturally occurring diseases fall in the purview of homeopathic scope. Whereas there are some diseases which are iatrogenic. Iatrogenic in the sense they are caused by some medicines already taken for some other ailment. Those diseases homeopathy cannot treat. For example, under some disguise the person is under steroid therapy. So the sequelae of steroids can't be overcome with homeopathic medicines because it is not a natural disease. It is an artificial disease caused by the drug. So the action of the drug has to be over to get rid
Before
of
you
that
can
symptoms.
begin homeopathy.
We cannot treat iatrogenic diseases, but there are some cases where the sequelae we can treat. We have seen, suppose, some cases of snake bite. Though it is not a natural disease, it is a snake venom which has caused the disease. But the sequelae of that we can treat many times. Like we have seen some non-healing ulcer after snake bite. We have treated it conservatively, and without even skin grafting, we could recover the whole tissue. Even we have averted even amputation in the fingers, where because of viper it was getting gangrenous and they wanted to amputate. But with homeopathic intervention it could be conserved. We have cases where you can't see even the scar of the snake bite now. It was a viper bite.
If a personal story about my father, who had very severe rheumatoid arthritis, and this may be well known to you, but he was in a wheelchair, and we had heard about a doctor in Mexico who was curing rheumatoid arthritis. So I actually got him on a plane and went to Mexico, met this doctor. He took x-rays, and then he gave my father 4 big injections in the neck and tablets. Within 15 minutes, my father was able to walk out without pain, going down these big steps in Mexico, maybe 1 foot gradation, and it never came back. We found out that the medicine was originally from France, but we don't know anything more about it. How can that happen?
That can be a rare incidence. Otherwise, rheumatoid arthritis is supposed to be what we call autoimmune disorder. So with local injections, maybe that area like they give local steroids in that area, may be released, but having a permanent cure after one course of allopathic medicine, I'm talking, is rare.
And for 10 years,
That too,
he had no
it's a
pain.
great. But in homeopathy, we have wonderful scope in treatment of rheumatoid arthritis. Not only that, all autoimmune disorders, they can be treated with homeopathy. Of course, we have seen some terminal cases with lupus, that systemic SLE, what we call.
Yes.
Those cases, if they are advanced where the vitality is depleted so much, we couldn't help much. Because mainly our medicines act through the vitality of the same person. And when vitality is depleted, what we call beyond repair, beyond recovery, there the homeopathy has limitation. So we suggest palliative, just palliative.
So it's the vitality of the person
Yes,
that is key.
mainly main seat of action is the vitality. Therefore, but that is an asset also, because what we do is when the person has good vitality and we stimulate that vitality to restore health, but then that restoration is always permanent, because what we call it is like an active immunity is given, because its own vitality which has overcome the disease. So in future that disease can never come. But it has limitation also. When the person is like vitality is worn out, it is beyond recovery, then homeopathic medicines can't do anything. That is the limitation.
We had talked previously about diabetes, and so many people in the ashram are diabetic. Is there one treatment in homeopathy for diabetes, or is it multiple?
It can't be. See, like generally people come with complications of diabetes. Diabetes itself will not cause any issue. But the people, they come with complications of diabetes, like say for example diabetic neuropathy. In diabetic neuropathy, the person loses sensations in the feet and hands, and he is exposed to trauma, wounds, because if one doesn't get pain, one is exposed to wounds or injuries, and therefore he develops infection. In that, even arterial blood supply also is lacking in the periphery, and therefore lack of blood supply, lack of sensation, there occurs what we call diabetic gangrene or diabetic neuropathy, and there with these complications patients come. So homeopathy is very good in that. But again, same thing, the vitality of the patient has to be intact, because diabetes as such is a functional disorder. It's a functional disorder in the sense it is just a hyperglycemia, where as a delusion or as a compensation it is raised, it is maintained by the body under delusion. So that can be reversed if there is no complication of diabetes. But where there are like tissue damages, the structural pathology has advanced, there it goes very difficult to reverse it. But we can prevent further happening. We have treated cases of diabetic gangrene. Gangrene where it was what we call threatened gangrene. It was not well established gangrene, threatened gangrene, and the patient has recovered. Not even a corner of the digit was amputated. But if already the person comes with a damaged organ or a part, as a sequelae of diabetes, there we can't reverse. We can just prevent further damage. So that's the limitation of homeopathy.
Do you ever consult with allopathic doctors?
We do take their support, especially in diagnosis and management. We have done it, especially like if there are some complications in ophthalmic disorders, we take advantage of their experience. Rather, I have seen some surgeons Like I mentioned earlier, Dr. Mistry, he's a surgeon but he practices homeopathy. So with his experience, I have seen him diagnosing rare disorders. Even with sonography and CT scan, we couldn't diagnose such diseases. He has diagnosed even with physical examination. So we do take their support in diagnosis and management of disorders. I remember like one case where the kidney function was impaired, and one kidney was resected, removed. And when the other kidney also started failing, that case came to me. And I referred this case to Dr. Mistry because the girl was only with one kidney. So we didn't want to take risk in this case. And just mere physical examination, he told it is a floating kidney and it has to be just fixed. And she will be all right. And this was fixed by a surgeon. And he told that even the other kidney must have been floating. It would have been saved. And that girl now she has grown up, got married, and having children now. So we do take support from allopathic people.
What about Ayurvedic and homeopathy?
Ayurvedic, I don't have much experience, but we consider that homeopathy is sort of a refined branch of Ayurveda. Because the principles are similar. Like in Ayurveda, each person is treated on the basis of Prakriti, Vata, Pitta and Kapha. In Ayurveda also the principle is that the person has a basic tendency to develop disorder and they treat based on that Vata, Pitta, Kapha. In homeopathy also similar concept is there that psoriasis, syphilis and psychosis, these are the basic miasmatic traits which gives rise to diseases, and we treat patients based on that. So the principles are similar, only thing is we use highly potentized and refined medicines, unlike Ayurveda. But otherwise principles are same. Rather, Ayurveda is supposed to be quite vast as compared to homeopathy. It's a old traditional science. Homeopathy is hardly 200-year old.
Yes. What are the most recent advances in homeopathy?
See, there are new drugs are being proved and reproved. But one wonderful thing in homeopathy is what is proved before 200 years still stands true, still holds. Rather, it is what we call reproved and confirmed. This is the best part of homeopathy. So what drugs, like 99 drugs were proved by Samuel Hahnemann himself in his lifetime. And all those drugs, newer and newer dimensions of those drugs come now. But what he has discovered is definitely standing to the even present day's test.
So from the 99, how many are there now?
All now they are more than 500 well-proved drugs. Yes, more than 500 drugs.
I see. Any other problems with homeopathy that are difficult to resolve?
What we call one-sided diseases, where the person doesn't have many complaints and peculiarities are not there. What we call, we get cases where only if it is only one complaint and nothing else to differentiate, there it goes very difficult for us to treat the person. What we call one-sided disease, especially mental ailments. If the person has a mental illness, the person comes with just mental illness which is reported by the attendants or observed by us, but we don't get all other reliable peculiarities. We need the totality of symptoms to match with the remedy. So if only one symptom is available, then it goes very difficult for us to come to the remedy. It is almost like what we call trial and error type. So the most seemingly similar we give, and then some symptoms come up with the inception of that remedy, and then we go on taking. So it takes pretty long time, especially the eczema, the mental symptoms, diseases. We have a limitation.
Yeah.
Like if the person has symptoms at all levels, like cravings, sleep, dream, then physical complaints, mental complaints, past history, even family history, then things go very easy to work out because we have lot of data which we can match with the remedy.
Hmm. So it's those singular cases that are most difficult,
Yes, we call them one-sided cases.
one-sided.
Yes.
Very good. Thank you so much.